very good morning. Praise to Allah subhanahu wa ta'ala. We have been graced by the chance together in this momentous webinar Deal MPM with me, Muhammad Syukur bin Suhaimi. Today we are listen and learn about a topic which is Medical Specialist Pre-Entrance Examination, or easy to call MedEx. Medical Specialist Postgraduate programs conducted by Malaysian University have produced more than 8,000 specialist doctors nationwide since 1981. Therefore, MedEx, or we call it Medical Specialist Pre-Entrance Examination, is established by the Medical Dean's Council of Malaysia as a uniform system of pre-entrance examinations conducted jointly with the Malaysian Examination Council MEC under Act 225, hence the authority to conduct examination for candidates who are not yet registered students of the university. Since then, the academicians are relieved of the logistical burden of conducting the examination, which is now placed under the MEC. Well, in our meeting room today, we are here with Professor Dr. Zaleha binti Abdullah Mahdy. Good morning, Prof.
Good morning, Syukur.
Okay. Before we continue the webinar, I would like to introduce our panel for today. Before we continue the webinar, I would like to introduce our panel for today. Before we continue the webinar, I would like to introduce our panel for today. Before we continue the webinar, I would like to introduce our panel for today. Before we continue FRCOG in 2018, Masters in OB-GYN UKM, and Doctorate in Medicine, Newcastle University, United Kingdom. She is currently Professor and Senior Consultant Obstetricians and Gynecologist at UKM Medical Consultant Obstetricians and Gynecologist at UKM Medical Centre, having finished a 3-year term as Dean of the UKM Faculty of Medicine in February 2019. Between February 2016 and November 2017, she also the Director of UKM's Teaching Hospital. She helped the Malaysian Medical Dean's Council establish the MedEx examination in collaboration with the Malaysian Examination Council MEC, and has been chairperson of the MedEx Steering Committee since 2019. Currently, she also chairs the MMC Specialty Subcommittee for Obstetrics and Gynecology Training and the Housemanship Education Subcommittee. In 2022, she was Elevate Fellow of the Academy of Sciences of Malaysia. She is currently the Honorary Secretary of the Malaysian Society for Simulation in Healthcare, MASSH, a trainer in ICOE, Intensive Course of Obstetric Emergency, a research committee member of the Society for Simulation in Healthcare SSH, and was previously President of Perinatal Society of Malaysia 2019-2021. She will be speaking on background information regarding MedEx and frequently asked questions about MedEx. Without further ado, ladies and gentlemen, please welcome Professor Dr. Zaleha binti Abdullah Mahdy. Please welcome, Prof.
Thank you, Syukur, and I would like to thank the organizers, the Examination Council of Malaysia, for giving me this chance to speak on MedEx. MedEx is short for Medical Specialist Pre-Entrance Examination, or peperiksaan pra-kemasukan ijazah lanjutan perubatan in Malay. It was established by the Medical Dean's Council of Malaysia and conducted by the Malaysian Examinations Council or Majlis Peperiksaan Malaysia MPM under Act 225, as mentioned by Mr. Syukur just now, hence the authority to conduct examinations throughout Malaysia. It serves as one of the screening criteria to select good candidates to join clinical specialist training programs in Malaysian public universities. Different specialties apply different lists of selection criteria, so please refer to the selection criteria specific for the specialization that you prefer. This is accessible in the MPM website on MedEx. That is the link that I've provided there. MedEx is conducted once or twice or 3 times a year, depending on the specialty. For 2023, for example, there were 3 MedEx sessions. Session 1 was conducted in April 2023 for obstetrics and gynecology, ophthalmology, and pediatrics. session 2 in August 2023, sorry, the typo error there, for obstetrics and gynecology only, and session 3 in October and November 2023 for all specialties, all 22 specialties. So we have just released the results of our latest examination recently. This is how the examination dates will be published. So look out for it. If there's any changes, for example, it will also be announced. The examination fee is 800 Malaysian ringgit for each paper. One paper represents one medical specialty except for pathology, which represents both general pathology and forensic pathology. The result is valid for 3 to 5 years, depending on the specialty that you choose. Now, if you pass the MedEx exam, will you be guaranteed a place in the clinical specialist training program? No. You're not guaranteed a place, but your MedEx result is one of the essential requirements to join the clinical specialist training program. There are other selection criteria to be fulfilled as well before you can be admitted into the program. For further details for each program, please refer to the selection criteria accessible in the MedEx registration portal. How is the MedEx results expressed? It does not give a pass or fail result. Instead, it is given as band 1 to 6, just like the Malaysian University English Test or MOET examination. For the 2019 examination, which was the first MedEx examination, the cutoff marks for the bands were predetermined, and each specialty decided which band will be considered as the cutoff requirement for progress into the next stage of the selection process. For example, an objective structured clinical examination or OSCE, or an interview session. For the 2020 examination onwards, each specialty committee determines the cutoff marks for the bands for their own examination paper, and band 4, 5, and 6 are those that will be selected for the next stage of the selection process, be it the OSCE or the interview session or direct admission into the program. Do you have to pay for the next stage in the selection process? Well, special payment may be required for certain specialties that impose additional screening methods. For example, OSCE besides interview. The interview itself is free of charge. It is only when there is an additional exam that is imposed, then you may be required to pay an additional fee by the specialty concerned. Can you sit more than one MedEx paper at one time? Of course you can. You can sit as many papers as you wish based on the MedEx schedule given. But you need to check the MedEx paper schedule so that the papers do not clash with one another. If you are a house officer, can you sit for MedEx? Of course you can again. Anyone can sit for the examination, but you need to check the selection criteria for additional prerequisites to join the clinical specialist training program of your preference, because some programs may require you to have a certain number of years of experience as a medical officer before you can join the program. So please be aware of that. Is there a limit to how many times you can sit for the MedEx? No, there is no limit. You can sit for as many times as you wish, as long as you pay the fees for the MedEx examination. If you do well in MedEx, will you automatically qualify for training scholarships? Right. The HLP from KKM, from the Ministry of Health, or any other training scholarship is managed by the sponsor. For example, in this case, the Ministry of Health, according to their terms and conditions. So you need to check with the respective sponsors, not with us. Is MedEx a compulsory requirement for entry into the medical specialist program? Yes, MedEx is one of the compulsory requirements. For further details for each program, please refer to the selection criteria accessible in the MedEx registration portal. How many medical specialist programs offer MedEx? At the moment, all 23 medical specialist programs offer MedEx, including forensic pathology, which is embedded within the same MedEx paper as general pathology. The rest are anesthesiology, clinical oncology, emergency medicine, ENT or ear, nose and throat, or otorhinolaryngology, that's the other name, family medicine, general surgery, internal medicine, neurosurgery, obstetrics and gynecology, ophthalmology, orthopedics, nuclear medicine, pediatric surgery, pediatrics, plastic surgery, psychiatry, public health, radiology, rehabilitation medicine, sports medicine, and transfusion medicine. Is MedEx limited to Malaysian citizens only? No, it is not. Foreign citizens can also sit for the MedEx as preparation for entry into the Malaysian Medical Specialist Program. Again, for further details on the prerequisites for entry, please refer to the selection criteria accessible in the MedEx registration portal. Specifically for non-citizens, there may be certain additional requirements depending on the specialty. If your basic degree is from an unrecognized university, if you take the MedEx examination for a specialty, do you still need to take the examination for provisional registration or EPR examination under the Malaysian Medical Council or MMC? Now, yes, you still have to. The MedEx does not replace the EPR examination. Is it true that to pass your housemanship, if you're a houseman, one of the examinations that you must take is MedEx? No, this is not true, okay? The criteria to finish your housemanship is quite separate from the MedEx examination. Now, if you took the specialty entrance examination in 2021, which is valid for 2 years according to the old system, which was not under the MedEx, and then after that, you notice that the specialty has started to use the MedEx as the entrance examination. Do you still have to take the MedEx if you want to apply this year, 2023? Well, this question is a little bit out of place already, but I just wanted to clarify just in case there are a few more candidates who sat for the examination in 2021 and is wondering what would happen to them. If you were applying for this year, which I believe, the application period has already closed by now, you don't have to take the MedEx of that specialty this year, since your specialty entrance exam is still valid. You can take the MedEx of that specialty this year if you want to improve your standing, or if you're considering entrance into the program next year onwards. Okay, the validity only applies until this year. Of the validity of the old examination only applies until this year, as the last non-MedEx entrance examination was in 2021. This is only for certain specialties, not all. Will there be preparatory courses for MedEx candidates? Yes. The good news is MedEx preparatory courses are available as the initiatives of the individual specialty committees. More and more of the specialty committees are providing preparatory courses for MedEx. In 2022, 8 specialty committees offered preparatory courses for MedEx, and I believe it must have increased this year. So please check with your specialty of interest with regard to the latest preparatory courses. A few tips for MedEx. First of all, you need to decide well which specialty you're interested in. Please read the selection criteria and the scope of knowledge for each of the papers offered for MedEx on the MedEx portal. Prepare yourself well academically. Look out for the preparatory course for the respective specialty and enroll yourself. Be alert to the announcement of the opening of the registration portal for the examination. You can see when the opening is in general. If you look at the calendar that I showed you at the beginning of my talk just now. Be meticulous about the examination instructions and advice. And I seriously mean be meticulous. Read the small prints about the examination instructions and any advice given by MPM about the examination, the do's and don'ts. We are at the moment conducting the examinations ever since the time of the COVID when things were difficult. We are conducting it online, okay? And we mean to continue the examination online indefinitely because of the many benefits of online examination on both sides, the invigilators as well as the organizers of the exam as well as the candidates. Okay, you can now sit for the exam from home, from wherever you are, or from your hospital or your office, wherever. Okay, as long as you adhere strictly to the examination instructions and advice. Okay, we are very serious about the instructions and advice, so do not take it lightly. Stick to them in total. Okay, and on the day of the examination, log in well before the commencement of the paper that you are sitting as per the advice in the examination instructions. So with that, thank you very much. We would like to wish you all the best in your MedEx examination.
I think we have gained a lot of information about the MedEx today. So I would like, as the moderator for this morning, I would like to express my gratitude and thankful to our speaker today, Prof. .ZALEHA, and all the webinar participants involved. So thank you, Prof. Hope to see you again and in the next deal webinar soon. And for you guys, stay tuned for any updates from our social media, Majlis Peperiksaan Malaysia. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much.